Good morning, welcome. We're gonna hold just for about a minute as we let everyone in from the waiting room and make sure audio is working for everybody. So while you're waiting for us to join this morning, there is a link in the chat. So if you can fill that out for us if you would like, that just allows us to know who all joined and be able to report on that in our community planning as well. So as you're joining, we'll start in another minute, but there is a link in the chat. If you are joining in person, there's a sign-in sheet and demographic form at the site that you are at as well. So we can fill those out during this time too. And Patty and Paulina, if you can let me know if you feel like the waiting room is slowing down. Otherwise, I'll wait till just a little after 10:03 and we'll continue to move forward.
I think it's slowed down a bit. I think that we should be okay to get started. I don't see anyone waiting right now.
Okay, fantastic. Thank you. Okay, well, welcome again, and thank you for joining us this morning to be a part of the Lake County Community Planning Meeting for the fiscal year 24-25 annual update. So just in case you missed this first announcement when you were joining, there is a link in the chat, and that is something that you can complete to report your attendance today and share demographics if you wish with us. You can either use that link that's right in the chat that Paulina has shared, or you are able to scan the QR code on your screen if that works. If you are joining us in person at one of the peer support centers. Oh, I'm gonna just ask if you are joining right now, if you can mute yourself. That'll just help to make sure that everyone can hear, and then we'll be able to come off and share during different times. And then if you are at one of our peer support centers, you're able to, there should be a sign-in sheet there for you, as well as a demographic form to complete for in-person attendance as well. All right. Well, we do have a really full agenda this morning, so we're going to keep moving forward and start off the meeting. If I can move slides for us. There we go. All right. So again, welcome. Thank you for joining this morning for Lake County's Behavioral Health Services Mental Health Services Act Community Planning Meeting. And this is the community planning meeting as we focus forward on the fiscal year 24-25 annual update. So I am going to invite everyone this morning, if you are joining us on Zoom, if you would share your name and your pronouns and the program or relationship with Lake County Behavioral Health Services and the Mental Health Services Act that bring you here today. If you'll share that in the chat. I will apologize that we don't have time to go across all who are here today and do verbal introductions. We do want to be able to have some time to know who's here. And so later in the agenda this morning, we are going to have an opportunity to go into smaller breakout rooms and ask questions and share feedback. And we'll be able to do some more introductions then. So apologies for not having time for that first off in the meeting, but I do want to invite those who are joining us on Zoom, if you can put your introductions into the chat. If you are joining at one of the peer support centers, again, there's a sign-in sheet there, and we're really excited that you're able to join us. in that hybrid in person and then here on Zoom this morning. And with that, before I go over the agenda, Scott, anything that I want to pass to you this morning?
Yes, hello. My name is Scott Abbott. I'm the program manager at Lake County Behavioral Health Services for the Mental Health Services Act and Housing. And just want to welcome you out. Super appreciate you being here, spending the time with us to go over this. Part of the Mental Health Services Act, as you may or may not know, requires stakeholder input for the planning process, community involvement. And so this is just a vital piece of putting together our plan for what we're doing. And so your participation here is really grateful, appreciated that you're here. I also want to mention that today is also for our county is our point in time count that the continuum of care is doing. Our peer support centers are actively involved in that. Perhaps many of you who are out here are also involved in that. And we want to welcome those folks that are participating, particularly at the centers. Your presence here is very welcome and appreciated, and hoping that you will have some valuable feedback for us as well. The other thing I just kind of wanted to say is, kind of question I ask myself all the time is, didn't we just complete the last one?
She's
Update.
up there with Billy.
And that's accurate. We did just review the last update within 6 months ago. Actually, we created the plan for this year 23 through 26, and we're required to update that plan annually. And so this is the very first part of that, of the update for this coming year. The updates themselves, the process takes nearly 6 months to do. So that's why we start halfway through the year. I'll turn it back over to our consultants for this, which is RDA. Courtney, Paulina, and Jamie are here representing them. I also have Patty Russell here representing our Mental Health Services Act analyst. And so between the 5 of us, hopefully we can inform you of what we're trying to do and work with you. And I'll turn it back over to Courtney.
Thank you, Scott. And yes, I am with RDA Consulting and have the privilege of working with the Lake County Behavioral Health Services team to support the annual update this year. And so what to kind of expect as we go through this morning. Sorry, there we go. So what we're going to really spend some time together today is looking a little bit at just the background and overview of what is the Mental Health Services Act, and just provide you all some context and what we're talking about as we move through the other pieces of the agenda. So we'll go over the background. We'll also really focus in on the annual update that we're looking at now, as Scott mentioned, and look at what you can all expect from that planning process. There are some proposed changes on the horizon for the Mental Health Services Act. So we are going to spend a little bit of time this morning sharing about the Mental Health Services Act modernization overview, and have a little bit of opportunity to have some question and answer around that. And then a large amount of our meeting this morning is really getting to hear from programs and services that are funded with MHSA dollars. And so you'll get to hear brief updates and overviews from those programs. They will be short this morning. So no, it won't be able to account for all of the work that's happening, but you'll get to have that update from each program and service.
And real quick with that, the idea behind that is, in this planning process, we want to make sure that the community has an understanding of what we're already doing, so that can help inform you what still needs to be done or what improvements can be made.
Yeah. Thanks, Scott. And then from there, we'll take a quick break, allow everyone to stretch. And during that time, we'll be setting up to go into breakout rooms. So as I mentioned, we will have an opportunity. We're going to talk to you a lot to start and have some time for questions. But at the second part of our agenda is really to go into smaller spaces to have conversation together, to hear from you about what you just heard this morning, as well as learn from your experiences and knowledge about what community needs are. So we'll be able to have those more focused conversations. And then we'll be able to close out with what are those next steps and what to expect. Okay, so a couple of quick housekeeping things just to help as we are all in our Zoom and hybrid environment for this meeting. So those who are attending in person, you do have a point person or a coordinator at each center is kind of your go-to to help. So they are going to have things like sign-in sheets, and many of the links that we are going to share in the Zoom chat are provided to the centers and are in paper and print version. So we should have duplicates of everything that you're seeing on the screen for you at the centers as well. If you are attending virtually today, if I can just ask when it isn't a time to share, if you can have your speaker muted, that just helps ensure that everybody can hear what's happening and we kind of minimize that background noise. Again, when we get to those times of sharing, we will encourage both sharing and chat. You are welcome to put comments in the chat. We are reviewing that. We do keep track of that as well. So please feel free to use that source. And then when we get to question and answer or focus groups, if you can raise hand function, that will just make sure that those of us who are facilitating know you have a question or know you have something that you'd like to share, and we'll make sure that you are able to come into the conversation. So that'll just help us this morning. Same if you are in person, raise your hand. Your site coordinators are going to be on the lookout for that. And they'll make sure that they can also ping into the Zoom room if we need to pause and get a question from any of the in-person sites. All right, just a few more things with that. So if you're on your computer, these are just kind of some notes to help you engage in today's meeting. So you can use the raise the hand icon. You can use the chat as we discussed. If you are joining us via phone this morning, to speak and raise your hand, you just press *9 and that'll let us know that you want to engage as well. And then another option, if those do not work or you feel like you would like to just send another comment or question over, is you can email Scott directly, and his email is there. We'll also share it again at the end of the presentation so that you have a few contacts to reach back out. Okay, now we are getting into the meat of this morning. So let's spend some time of really just looking at what is the Mental Health Services Act and what is some of that background. And so the Mental Health Services Act is the predominant funding source that many and most counties across California are using to support mental health services and programs for community members. So this is an act that was passed by voters and is part of law. It is unique to California. And it was passed back in 2004. So it has been something that has been a part of mental health services and programming for some time. What the Mental Health Services Act is and where that funding comes from is it's a 1% tax on those who have an income over $1 million. And what it is really intended to do is to support the expansion and transformation of mental health services. So what does that mean? What does that look like when that money is being planned for county use? So there are 5 core values and principles to the Mental Health Services Act. And so you see those in those boxes there, but wellness, recovery, and resilience. So really being proactive and ensuring individuals are not deteriorating in their mental health before they're able to be connected and receive services. So also really focusing on that recovery vision and promoting hope and personal empowerment, respect and social connections, self-responsibility and self-determination. Really focusing on being client and family driven in service delivery and planning. So again, centering individuals who have the lived experience to really drive what those services are and what care looks like. Integrating service experience. So really supporting access to a full range of services and providing multiple agencies and programs and funding sources, working together in a really comprehensive manner. And so you'll see that with the program updates today and all of those different range of services that are happening. Ensuring that programming and services are culturally competent. So really expanding and making sure that things are culturally and linguistically meeting the needs of community members, and that might look different in every community, and prioritizing a focus on equitable service delivery and really reaching out to individuals who are maybe underserved or harder to reach or marginalized from other services. And then finally, community collaboration. So really ensuring that there is that local control and impact and decision making. And today is a part of that. These program planning meetings, the surveys we'll talk about, and many other opportunities throughout both annual updates and 3-year planning periods. All right, so what makes up the Mental Health Services Act, or MHSA? And I'll probably switch to that to save words, but Mental Health Services Act and MHSA. So there are 5 areas to the Mental Health Services Act, and where that funding is really divided. And we'll be able to look at that a little bit more too with modernization. You'll see a slide that shows that funding breakdown. But there's community services and supports. So this is really outreach and direct services for serious emotional disturbances or serious mental illness for individuals of all ages. Oh, go ahead, Scott.
I was going to say, in this part of community supports and services, one of the regulations around that is that half of those funds have to be used for the full service partnership program.
Yeah, perfect. And then the other under that is prevention and early intervention. So really preventing the development of mental health problems, screening for and doing that early intervention for the early signs. And similar, oh, go ahead, Scott. You're probably going to say the same
thing. Go ahead, I can tell you're going to say it.
Similar to community services and supports, but half of PEI funding, that prevention and early intervention funding, goes to children and youth services. And so there's a wide range of that, but that's where half of that funding goes. We say the same thing?
Mm-hmm.
Okay. The other pieces that funding supports is innovation. So really being able to test new approaches and try innovative things in community. That funding isn't meant to be sustainable over years, but to give kind of a one-time support to something new and something learning for research pilots or other innovative programs and services. And then the final 2 are workforce education and training. So being able to build, retain, and train a qualified and well-supported mental health workforce. And then capital, facilities, and technology needs. So between those 2, about 10% of funding can be allocated there.
From CSS.
Yes. Okay. So we said the different areas, but what does that kind of look like when we're looking at the fiscal year 23 and 24 MHSA programs? So under community services and support, we have the Crisis Access Continuum, Forensic Mental Health Partnership, full service partnerships there that were mentioned, Native American peer counseling, older adult access, parent partner support, trauma-focused co-occurring disorder screening and treatment, outreach and engagement, and the peer support recovery centers. And again, we'll get updates from some of these programs later on this morning as well. For prevention and early intervention, those are early intervention services, family stabilization and well-being, older adult outreach and prevention. Again, the peer support recovery centers and outreach and engagement, postpartum depression and screening, mental health first aid, prevention mini grants, and then statewide, regional, and other local partnerships that fall there. And then you can see kind of in this far column for innovation is the multi-county full service partnership innovation collaborative. And then for capital facilities and needs, electronic health record project and other capital facilities, and then workforce education and training. Okay. So that's the high level overview of what we're talking about when we're talking about MHSA. There are many other details to that. And so do want to just share with you that those are available and there are additional resources on the Lake County Behavioral Health Services website. So you are always able to go there and access information and learn more about MHSA programming. So we'll have this link available. I think it's also, we can share it in the chat for you, so you'll see it there. All right, so now let's focus in a little bit more specifically on where we are today with the annual update and the community planning process. And so this really is kicking off that community planning process. And as Scott said, it seems like we just did this for the 3-year plan, but this is an annual piece of now that implementation. And so really the purpose of the annual update is to provide updates to the adopted Mental Health Services Act 3-year program and expenditure plan for fiscal year 23 to 26. So that was conducted last year, finalized last summer. So this is providing an update to that. So what's going to be a part of it is program status updates and accomplishments from the 2022 to 2023 fiscal year. And then reporting of any program changes that are going to be planned for in the upcoming year or any updates to the plan. And then with that, what is really important to MHSA funding and programming is really having meaningful stakeholder and community engagement. And so ensuring that there is local experience and expertise that is informing the development of plans and helping really identify what are those gaps in community needs that can be maybe better filled or improved upon. In addition, during this period, you'll see the PEI evaluation report. So again, PEI is prevention and early intervention. So during fiscal year 18 to 19, the Mental Health Services Oversight and Accountability Commission, or MHSOAC, so that acronym you see there, updated reporting requirements specifically for prevention and early intervention programs. And so what that includes in the annual report is you're going to see how many consumers, how many individuals were served, what were the demographics of individuals served, as well as highlights of program accomplishments from that past year. And then again, any specific program implementation and outcome information is reported as a part of that. As part of the 3-year plan, there is also a 3-year evaluation report that really looks at those same things, but over the whole course of that 3-year plan. And when we say stakeholders, when we talk about that community planning process, the program planning really is to be developed with many different sectors, many different partners who are a part of that. So really thinking broadly of who touches the mental health system. So that might include adults and seniors with severe mental illness, families of children, adults, and older adults who have severe mental illness and may be receiving services, providers of mental health services, law enforcement agencies, education agencies, social service agencies, veterans and representatives from veterans organizations, providers of alcohol and drug services, healthcare organizations, and other interests as may be unique to a community. And then who are the different roles and what is really, where is this work happening? So when we look at that, there are the community stakeholders, those that we just referenced, and you all here with us this morning. So this is really individuals who are presenting their perspectives, their experiences and knowledge of being part of the community, and being able to really support what are those emerging strategies that are needed to fill gaps. There's the Behavioral Health Services Department, so Lake County Behavioral Health Services, who really are responsible for developing the annual update and ensuring that it is reflective of that community feedback and that community planning period. There's the Mental Health Advisory Board, which is also there as a level of insurance to ensure stakeholder involvement. They also have a role in reviewing and supporting any revision needs to that annual update, as well as a public hearing. And so we'll see that timeline a bit later. And then the Board of Supervisors for the county are really at the end, those who review and approve the plan. Our role, again, as Scott mentioned, is really supporting this period of data collection and plan drafting and development. So quick timeline here of what to expect. We really have begun planning for the annual update in December, but where we are now is in this phase 2 needs assessment. And so this will really run over the next couple months. So there's this meeting. You may have already seen this. We will also share this a couple more times throughout the meeting, but there is a community survey. So today is not the only opportunity to give feedback, but really participating in that community survey. For those of you who are in person at peer support centers, there are hard copies of that survey there as well, in addition to the electronic survey. So those are great ways to give feedback. And then continuing to look at program data, outcome data, what we're seeing from actual service data. So from all of that, we will analyze and kind of synthesize what we hear and identify those top community needs and what we're hearing come out of that. And that will support planning for the next year. And so what that will look like in March and April is another community planning meeting. We'll actually come back and report what we heard, what you shared on the survey. And Lake County Behavioral Health Services will report back on some of that as well. And then in the kind of late spring, early summer, we'll actually be developing that plan. There will be another opportunity for public review and comment, as well as a public hearing to give any feedback to that annual update. Okay, so that kind of brings us to the end of the Mental Health Services Act training and overview. So before we move forward into sharing some of the proposed evolutions and changes to that, we do want to do just a quick poll, and that should be popping up in your browser right now. So if you can just spend a few minutes.
We have 3 families. We're going to be intaking another one, and I will have 2.
And answer that. It looks like we are getting some answers in. So again, if you can rate that, and then I think if you are at the centers, if you can just kind of raise your hand of if you strongly agree, and if you have any other feedback for your center coordinators, please do share that. We would very much welcome that feedback. Looks like a few more people are still working on it. Okay.
And we do this poll. This is one of the requirements to ensure that stakeholders receive training. And so this is that confirmation that you have received training.
All right. It looks like the poll has slowed down. Thank you for responding to that. We'll go ahead and close the poll. And then I am going to pass to Jamie to share a little bit about MHSA modernization and some of the proposed changes there.
Great, thanks, Courtney. And you can go on to the next slide. So we know we just talked about what MHSA is, and as Courtney mentioned, MHSA was kind of passed in 2004, which is now 20 years ago. So as part of Governor Newsom's kind of efforts to kind of transform the mental health system in California and better meet the community needs, there's also an effort to kind of update the MHSA to better meet the community's needs and the state's needs, and kind of keep up with the needs of the population. So MHSA modernization, you may have heard Proposition 1 or Prop 1 kind of floating around, and that's MHSA modernization. And this is a legislative statute that's intended to kind of modernize or update MHSA, as well as expand housing and treatment options for folks that have serious mental illness. And so this is a voter initiative. So this is going to be on the primary election ballot on March 5th. So everybody kind of has an opportunity to go and vote yay or nay on MHSA modernization. And now we'll get into a little bit of like what's actually in Proposition 1. So Proposition 1 has two main components. The first one is really around infrastructure. So there's kind of been, as we all know, there's a lack of appropriate treatment options and facilities in California, as well as a severe lack of appropriate housing. So the first component of the MHSA modernization, or Proposition 1, would actually be authorizing about $6.5 billion towards either the building or the development or the rehabilitation for behavioral health housing and treatment. So for the first part of this, about 2/3 of that $6.5 billion is going to be going specifically for inpatient and residential treatment beds. About $1.5 billion of that will be earmarked specifically for counties and local governments through grant or loan programs. The other third of that is going to be earmarked specifically for housing, again, going to local communities and governments to either build or develop or kind of renovate different infrastructure to build more permanent supportive housing. And about half of that, so $1 billion specifically, will be earmarked for permanent supportive housing for the veteran population. And through these this $6.5 billion, they're hoping to add about 10,000 new treatment and housing units for folks with serious mental illness. The other half of it, which is probably the other half of it, is kind of the MHSA modernization. So this is the part that's actually going to be updating the Mental Health Services Act that was passed in 2004. So the first part of it is that it's going to be expanding services to include substance use treatment. So currently, the MHSA, or the Mental Health Services Act, only funds substance use treatment if it's for folks that have a co-occurring serious mental illness. So this would actually expand to folks that don't necessarily have a co-occurring mental illness. They might just have only a substance use disorder. So because there's this expansion to substance use treatment, it's also renaming the Mental Health Services Act to the Behavioral Health Services Act. So it'll be the BHSA if it passes instead of the MHSA. The other really big change is that it's going to be revising the distribution of MHSA funding, and we'll get into that a little bit more on the next slide of what that actually looks like. But again, there's going to be a change in the way that counties can use the money and the way that it's allocated to prioritize housing interventions for those with serious mental illness. Because of this redistribution of kind of how the money is going to be allocated, it's also requiring counties to really try and maximize the use of other funding sources. Outside of MHSA, one of the biggest funding sources for mental health departments is Medi-Cal, and being able to bill for those Medi-Cal services. So the BHSA, or Behavioral Health Services Act, would really be requiring counties to be leveraging Medi-Cal for services that may have otherwise been funded through MHSA.
And
then,
by the way, Lake County does do that.
Thanks, Scott. And then the last kind of piece is that it's also going to be establishing different and additional oversight and accountability measures. There's a whole host of these, but like one of the things that you'll kind of see in terms of the planning process is that because now there's this kind of expansion of, or asking counties to use Medi-Cal or to kind of leverage other funding sources, you're going to be asking these plans to kind of also include all of the funding streams that are being used to pay for behavioral health services. And also taking a more collaborative and kind of coordinated approach with Medi-Cal managed care plans, and also working more with the community health improvement plans in each county. There's some additional things to that, but those are kind of like the key things in relationship to the planning process. Next slide, please. Okay, so there's a lot of information on this slide, but this is showing how the money is going to be allocated differently. So when Courtney kind of went over the existing allocation on the top, this is the current allocation. So the amount that's going to be coming through MHSA, it's still going to be a 1% tax on millionaires. So the amount of overall funding that's going to be coming in is going to be the same. So in the current allocation, of that 1% millionaires tax, 95% of that goes to the counties and 5% goes to the state for kind of administration and oversight. And then, as Courtney, just like a quick recap, so 76% currently goes to community services and supports, half of which goes to full service partnerships. Then about 20% goes to prevention and early intervention. And then there's this 5% for innovation. So this is going to change that allocation. So first, the overall allocation to counties is going to change a little bit. So rather than 95% going to the counties, 90% is going to be going, and 10% is going to stay with the state. 3% is going to be for that state administration and oversight. 3% is going to be towards state workforce initiatives like loan repayment programs. And then 4% is also going to be for statewide prevention programming. Of the 90% that's going to go to the counties, this is also going to be allocated a little bit differently. So a third is going to be going to full service partnerships. This is actually kind of similar to the allocation right now because half of CSS had to go to full service partnerships. But the big change is that there's now going to be a third that's going to be allocated towards housing intervention programs. So that's an entirely new component. Before, maybe a little bit of money could from MHSA could go towards housing for folks with serious mental illness, but now there's a whole third that'll be dedicated for housing interventions. And then the remaining third is going to be called this behavioral health services and supports. And so this is kind of combining the prevention and early intervention, the innovation, the workforce education and training, the capital facilities, and any other kind of programs that are not an FSP that would have been covered in community services and supports. And half of that funding has to go towards early intervention. Half of the early intervention has to go towards youth under the age of 20, children and youth under the age of 25. So there is a little bit of flexibility. So up to 7% from each of these different funding sources can be moved around. So for example, you could take 7% away from FSP and 7% away from housing intervention and allocate an additional 14% to behavioral health services and supports. Another thing is that within MHSA, and this would continue or might continue within Behavioral Health Services Act, is that there's often exemptions for small rural counties, of which Lake is one. So this isn't set in stone yet. This would depend if it passes, and then this is to be determined if it does pass. But there may be an exemption for small counties for the first 3-year planning cycle of this behavioral health services to not do the housing intervention for the first 3 years. Again, this is a big kind of unknown, but that is a possibility for at least the first planning cycle for small rural counties, that they may not have to allocate this 30% to housing interventions. So I'm seeing a question of, I'm seeing an actual reduction in county allocation with Prop 1. That's true, because 95% used to go to counties. Now, a slightly smaller percentage, 90% of BHSA will be going to counties. So it's a smaller amount that's going to counties, and then it also has to be allocated slightly differently.
So
Okay,
this
and
would,
now,
this would also, as we described, we have a 3-year plan already. And although Proposition 1 is in March, our 3-year plan would still be good. You know, it's not going to radically change our 3-year plan because the implementation isn't a little ways down the road. The next slide, go to that. I don't know if you can read this, because it's kind of small, but this is basically a timeline of what they're looking at. And so what they're stating in this timeline essentially is that in a year from now, we need to start planning. If this proposition passes, we need to start planning that transition and how we'll do that. Although the transition part wouldn't start until the 6 months later at the following fiscal year for any changes that would happen. So essentially this could, you know, start transitioning in the last year of our three-year plan, although it says we can also start transitioning even prior to that. So if this proposition passes, this will probably be, you know, really the last year we'll be looking at the allocations on the previous slide. If you go back to that, you can probably read that easier. Will be the last year that we'll really be looking at, you know, our current allocation, how we do things.
Thanks, Scott.
Sure.
And I know we're running a little bit behind, but I just want to pause for a moment and check the chat or see if there are any other questions about that update. And while we're pausing for a moment, I'll go to this slide. One, I do want to note these slides will be made available. So I know you're seeing resources in them that you may not be able to access now, but these will be made available. So there are some additional resources here about what was just shared. A pretty nice, easy to read fact sheet. There's a policy document, so encourage you to check those out. And then if you are in person at the centers, these slides should be there for you as well. So, but either way, they'll be made available.
There's some question in the chat from Kim, asking if this proposition passes, what does it mean for current programs receiving MHSA funding? And that's the magical question. So I'm not surprised that was the first question. This potentially could affect current programs. When you have to move a third of the budget to housing, you know, something's got to give to be able to do that. Behavioral health is actively looking for alternatives for funding, for any lost funding that we'll have. So for example, our peer support centers, which are so important to what we do and are funded through MHSA. There's another funding source which is on the horizon called BH Connect, which the federal government is in the process of approving for California. And it will allow for what is called the clubhouse model to be able to be utilized to fund our peer support centers. So we feel confident that with that particular funding source, we'll be able to continue our peer support centers without a skip, because of this change in the proposition.
Thank you,
But-
Scott. Does this mean, oh,
I was gonna say, but that we'll be able to support that, but other services, there could be a danger, and that's something we'll have to discuss over the next year, next year's planning process of, what our priorities are as a community.
thank you. I understand that we signed contracts for 3 years for the 3-year MHSA plan. So does that mean that we need to prepare our departments for the potential amendment of these contracts due to these potential changes?
Well, hi, Elise here. So
Sorry.
all contracts have a provision that they're contingent on funding.
Mhm.
That's in every single one. And so again, the shape of reimbursement for peer support for the centers may change. And of course, the drive is to get Medicaid, Medi-Cal revenue to support things, which we're down with. We understand that. So I don't know. There's a lot of unknowns right now,
Mhm.
but
Fair.
there are fiscal forecasting tools that have been provided to us that we're working through to kind of like mock out a budget of what things would look like should it pass. And so that's what our fiscal team is actually working on at this time. And then I think after we complete that work, we should have a better sense of the potential deficit, specifically regard to PEI. So it's a combination of PEI and CSS funding that prop up the centers. And so that's what we'll have to look at.
Thank you. Yeah, understand.
Yeah, and as Jamie mentioned, there's a possibility of a 3-year stay for rural counties and having to do this budget transition. It's recognized that smaller counties are very dependent on MHSA funding in providing programming. And so this is an exception for small counties to be able to continue with these particular services. It would be at least another 3 years, which would be, I'm sure we would consider to be helpful, but that's not a guarantee. As Elise mentioned, there's still a lot of hashing and gnashing of teeth to be done to figure out how this will fully shape out. But I think it's very important that our community understands Proposition 1 and how it could affect our community in what we do. So I strongly encourage folks to read more about this proposition and really, ponder as you go vote in March, and recognize that, for probably the next few years, things will probably be in transition of how we do MHSA. Also, as also Jamie mentioned, this will also expand what we're doing today to cover all of behavioral health in what we're doing in planning, not just the Mental Health Services Act.
Thanks, Scott. And just kind of follow up to that, I know there was a note in the chat asking about resources that could be shared. Again, these slides will be made available. The kind of snapshot of the budgets that you saw that Jamie talked over and Scott was referring to, they are in the fact sheet that is listed on this slide that is posted right now. So that is something that HHS has put out. So both that as well as the first link on this page has a few other PDF type documents and different things that can be printed and shared. So I think those would all be good educational tools. And then, of course, linking back with Scott and the local team for what that means locally.
We'll also be on our website. We're in the process of building a page just for about Proposition 1. And once we have that complete, Patty will send out an all broadcast that page is up. And so it will have all these links. It will have other information about Proposition 1,
Great. Thank you.
including what's in these slides.
So then on that note, just a reminder that this, to Scott's point, this is on the ballot this spring, so it doesn't directly and immediately impact the annual update we're working on now, but as I think we're all seeing, there are a lot of unknowns and moving parts, so there will have to be planning that happens soon after we know what happens in the March election. So that is the update now, and we'll continue then for the rest of this meeting to really focus on what's in the annual update, but just know that that's something that will continue to evolve with MHSA programming. So now we are going to get into the part of our agenda where you actually get to hear some of the updates and what's happening in programs and services currently operating. And so in this part, we have a number of different team members who are going to be sharing about programs and services. Again, we just only have brief time this morning, so it won't be all of the amazing things that are happening, but what you will hear and also then see on the slides are some of the numbers of individuals served and the demographic information, and then sharing about program success or accomplishment over the last year, a challenge, and maybe something that the program is working on right now. So I'm going to turn it over to Scott, and we're going to go through our program updates.
Okay, and so what we like to do, as I mentioned earlier, is we want to help the community, the stakeholders, you all, to understand what we're doing right now. And so we've asked our different program leads if they could give a brief, emphasize brief, description of what they're doing and what's kind of happening with each one, trying to answer these questions. Our first person that we have is Kara Ingram from the Harbor and the Nest. Kara, you there?
I am here.
Great.
Okay, so we have the Harbor first. The Harbor is a peer support center for transition-aged youth 15 to 25, and we serve 443 clients in the past year. We also provide door service to anybody outside of our age range. They can still come to the door and be served with services. A success that we had this past year is our Pride Prom that happened in June. It was the first Pride Prom of Lake County, and we were able to do that with funding supported by a PEI mini grant from Lake County Behavioral Health. I would say a challenge that we had this year had to do with staffing. In the summer, we had 2 staff leave and move on to other ventures in their life, and so rehiring and then getting our new staff kind of up to speed on current projects. And then we also, with one of a grant that we received, we were able to implement a culturally relevant Native American mural at a middle school. And something that we have coming up that's planned is another Pride Prom. We have Pride Prom 2024, and then we will also be working on a Night of Culture event. It's going to be a completely free community event that's going to showcase different types of performing arts between the various cultures that reside in Lake County.
Thank you.
I think we can move on to the Nest. So the Nest, we had some wonderful successes. We had some clients, mom was able to obtain her own housing and get a job and kind of keep up on providing a wonderful life for her and her children. We had another participant who reached 1 year of sobriety while in program with us, and that was also extremely wonderful. One of the challenges that we faced in the past year was moving. We moved locations from a much larger home into a smaller home. And so the moving process was tedious, and then also getting used to the downsized space and kind of acclimating to that. And one thing that's coming new for us is we received a PEI mini grant for a experiential parenting initiative to provide our parents and their children with social enrichment engagement opportunities that they wouldn't have access to due to being low income and not having the funds to do so. And so we're excited to be able to get our parents and the youth into new opportunities that they can, one, enjoy as a family, and also to have more experience in practicing different parenting styles in different social settings.
Great. Thank you, Kara. And
Absolutely.
Kara's also our COC point in time chairperson, so she is super busy today, so we appreciate her.
Yeah, so
taking
I
notes.
am going to sign off and go do pit count stuff, and I hope you all have a wonderful day. And yeah, and then Kim Guerra is my boss, and so she is here as well if there's any further questions for RCS.
Thank you. Next, do we have Crystal here?
Yes, I'm here.
Oh, great. Thanks, Crystal.
Okay.
Crystal is going to be talking to us about the Forensic Mental Health Partnership, FSPs for adults, older adult system of care. And I'm not sure if you have anything for trauma focused and co-occurring or not, but.
No. Okay. So with our forensic mental health program, we are working with the justice system, mental health court, and probation department. Kind of our biggest challenge is engagement and keeping individuals engaged and making sure we're providing I guess the recommended programs. I'm not sure how to say that. Sorry. We have had a lot of success with our court programs this past year. Our success rate for completing diversion has increased. So we've gotten to celebrate approximately 10 graduations from diversion where those were able to be sealed and dismissed. And they chose to also continue with services even though their diversion had closed. And they're doing very successful. We see that program growing, which is where we have a barrier of staff. But we've also been able to hire more staff. So this next year, I'm really hoping to see that improve, our numbers improve, and our graduation and completion improve as well. We've had approximately, I know it says 11 there. We've had approximately 25 to 35 participants for the past year.
Yes.
Yeah.
These are numbers from 22, 23, correct? Yes. So we've increased the number of consumers we're serving.
Yes, we have increased probably double easily. And I can see that happening for this next year as well, if not even more. And then we did have a group start that is focused a lot with our forensic population, but anyone is welcome for the co-occurring. We do have a co-occurring group that has been very beneficial to our forensic population as well as all populations in our community. Okay.
So move to FSP.
Yes. All right. So our FSP population is booming. They successes of that we were able to have a lot more permanent housing secured. So we have less participants spending time in transitional housing or motels for shorter lengths of time. So that has been a really huge benefit in stability and being independent in our community.
Yeah, this will, if you won't mind me injecting a little bit. For folks that don't quite know what the FSP program is, it's, as I mentioned before, it represents, essentially a third of MHSA already, half of CSS. And it's designed for the most vulnerable of our community, those who are, very impacted by serious mental illness, or, cause them to be homeless, problems with the justice system, repeatedly hospitalized. And so this program, which is a statewide program, is designed to help that population. And as Crystal was mentioning, one of the biggest things that we do is housing for that population. Sorry, I just want to set the ground there. Crystal, go ahead.
Yeah, I'm sorry, Scott. I should have had my brief description available first. I apologize
That's
for
fine.
that. Thank you for stepping in. Yeah, so a full partnership with our most vulnerable population. A lot of times it's, we get them when they're just coming out of the hospital, or family calls, that their family members are struggling and looking for help. It's a wraparound. There's individual rehab, there's case management, there's therapy, medication services. So as I was saying, a big thing is we've been able to reduce transitional and motel stays and increase independent living in the community successfully. When they're unhoused, how do we expect stability? So it's a big part of helping our community become independent and stable. We are offering groups. So there's several groups going that any full service partnership or any of our clients can go to, in coping skills groups, co-occurring group, and an art group as well.
Great. Okay, next is our older adult system of care.
So our older adult systems of care program is focused on our older population, 60 and above. It is probably one of our smaller of the program of these three programs that I'm presenting. It is the smallest of the three, not by choice. The difficulty really was COVID and reaching our older adult population. They are much more isolated. They're more isolated and I guess difficult to reach in areas. So this past year, we dedicated Raven Shepherd to all the older adults. She's working to reach out to the Friendly Visitors Program. She's supposed to be reaching out to the senior center so that we can make more contact, have a presence, so that we can get to know our older adults that may be struggling in the community, so that we can help. We provide individual rehab, therapy, medications, same services as we do for our other programs. Right now, there is about 12. And it seems to be going really well with Raven stepping in, and we hope to grow that through the years to come.
And part of this funding also goes toward your senior peer counseling too, which we'll hear about from later.
Yes. And so
Okay.
Yeah.
And then next, trauma-focused co-occurring disorder treatment.
Right. And I don't have much available. It was kind of, I guess, through COVID and put to the side. We did just start a co-occurring group about 2 months ago. So that is getting started. There is a drive to revitalize this program to serve our community, what is just greatly needed. So there'll be more to come on that.
Okay. Next is Geraldo here. Or Bonnie, anyone from Crisis? Might be doing a crisis. This is our participation for a crisis access continuum. And this represents our support of our crisis services, MHSA support of crisis services. It specifically funds during this time frame that we're looking at right there, crisis services that did not lead to hospitalization. So funding for interventions that we can do locally, follow-up interventions that we could do. This has done that. I see Elise can't keep quiet for this one, so I'm gonna let her report.
It's because I'm excited. So yeah, in this time frame, it was basically business as usual, which is our crisis team did outreach and support to the best of their ability. But honestly, primarily a lot of the work with the crisis team had been focused on 5150 assessments, which primarily take place in our emergency departments. So the state of California Department of Healthcare Services has required and negotiated a benefit with Centers for Medicaid to offer mobile crisis response. I would like to say that Lake County Behavioral Health had the first approved implementation plan for mobile crisis response in the state of California. We were actually authorized to go live on December 8th. However, we weren't ready to do that until January 1st, which was the requirement. So my assumption right now is that Bonnie and the rest of the team are doing that work. So mobile crisis response moving forward, it's going to change the shape of this a lot, but essentially it expands this benefit dramatically in addition to making it Medi-Cal reimbursable. So this particular program may change significantly in future iterations of the MHSA plan or BHSA plan, whatever happens. But essentially it's a 24/7, 365-day-a-year benefit where you can call the crisis line and they will come to you. And right now, actually, the benefit does include substance abuse crises. For example, you're struggling and feeling like you're at risk of relapse, or you would like to get into treatment and you're having some barriers, you're eligible for that benefit in addition to your more traditional mental health crises. So really, it's a very encompassing benefit. And that's what we're really moving to in the future. So that's what we did. And now this is what we're doing.
Yeah, I think, what we can say, as Elise was describing it there, is we're looking at MHSA right now to support, our mobile crisis. Right now, within this past year, the crisis continuum, has shifted to helping support what is part of that benefit is called the living room, which offers a location for our crisis team to be able to have folks go instead of sitting around in a very unfriendly ER with lots of trauma going on there, is to have more of what's called a living room, a more quiet area that people can relax for up to 23 hours, kind of get away from whatever is potentially happening. And so it's essentially respite care for yourself, so we're providing that right now. We're also helping provide temporary hospital stays, or I'm sorry, temporary motel stays for folks in the community that are in crisis that need maybe a little bit more than 23 hours of, they might need a couple of days. And so this kind of supports that as well. This was done by an update of our plan that we submitted about 4 months ago, put out to the community, which you probably saw, probably got emails about it. And so that's why it's a little different than what these numbers are reporting. Okay. Next, Carrie, are you here with us?
Of course I'm here. Can you hear me?
Well, yes, I was a little worried. You said you had some issues with one of the centers there.
Yeah, the Big Oak Center, they don't have their camera because someone stole their remote. But they were able to get the meeting up finally, and so they can hear us. They can talk to us. They just can't show their beautiful faces. So
okay, we're glad we're here. They're here.
Yeah, and I think that this one is Kendra's, isn't it?
This is
Outreach and engagement. Know the signs.
I think this is more the street outreach.
No.
No, this is all the community events that we table at.
Well, then let's step over to Kendra for a second then.
All righty. I know I looked at that one. Is that? So you can just see, these are just the different community events that our team goes out to, either tabling, talking with the community, outreaching, providing information and resources about what our organization does, and having those conversations right there in person with them. We also have on there our own Mental Health Matters month event, which happens in May on there, which we are starting some of the planning for as we start this new year. It's a really great way for us to touch base with all of our community members out there through all the different events and partner with our other agencies out there in our community.
Great. Thank you, Kendra.
Mm-hmm.
Now we'll go back over to Carrie for street outreach.
I'm Carrie Manning, Lake County Behavioral Health Services, MHSA team lead. So our street outreach program started in July of 2022, right? Or 2021, no, 2022. In that year, we served over 2,000 consumers. That's not necessarily like individuals, but we had almost 2,200 contacts. What we do is we go out into the community with our outreach van. Currently it's 2 days a week. Once we have more staff, that's been the challenge at being out there 7 days a week, is staffing. We go to the north side of Lake County on Wednesdays, and we go to Kelseyville, Lakeport, Upper Lake, Nice, and Lucerne. And then on Thursdays, we go to Lower Lake and Clear Lake and the Oaks. And one of the successes that I can talk about is last year during the pit count, met a person that was in their 70s, sleeping under a bush in the park in Lucerne, very angry about life in general, did not want any help, you know, because they had lost faith in the system, and was very angry, as you know, he had a right to be, that he was an older person and was not, you know, receiving any help. And of course, you know, he told me he didn't want any help, and I sat there and I talked to him for about, I don't know, a half hour, 45 minutes. And that was when the shelter was just opening up in Lakeport, and actually got him to agree to try it out. Because of him going out there and the support of our peer support centers and the support of the staff out there, he was able to obtain housing and start working on his medical stuff, and doing a pretty good job. So that is one of many success stories from the outreach program. We provide referrals within the community. We have a phone available if somebody needs to make a phone call. We were providing lunches, and we have hygiene products, environmental protection, including like tarps or beanies, socks, tents, hygiene, or cooling caps in the summertime and cooling blankets. First aid kits. So we try to, you know, when people say they need something, we try to order that and have that available on the van. And
Okay.
upcoming changes, we have talked about getting another van. So
That was in the budget for last year, for the last year's plan.
right.
We have 6 success stories too.
So, Carrie, we need to move along.
Yes.
We talk about the peer support centers.
Okay, so currently Lake County Behavioral Health Services has 4 peer support centers, and of course, you know, we contract with Redwood Community Services for the harbor. The Big Oak Peer Support Center is a very busy center. One of the successes is that we were able to assist a peer with their immigration status. This person was looking at being deported and needed some help. And so Davey and Edgar from Lavos were actually able to help this person clear up the issues that were going on. They were able to keep their job and remain in the United States. So that's a pretty big success. Also, an average of 50 people from the community come in and take a shower, are linked with medical care from Adventist with their outreach medical van. And then there's also the clothing closet. And during this time, a warm meal, and get assistance with their benefits from Catholic Charities and free phones and whatnot. And our plan is to extend the center into the office space next door.
Wound care. They also do wound care.
Okay. Next center, next slide.
Next center, Circle of Native Minds, which is where I'm at today. Our services have increased tremendously, and they just keep rising. There's so many different success stories, and a few are actually like sitting in the room today. So one that I can talk about, we had a woman that was unhoused, with support from staff. She was able to obtain a part-time job, work on her medical, work on her mental health issues, and is actually now housed. And then we've also had 5 different unhoused community members that are now living on their own as well in housing. And the plan, we just recently hired a lead peer support specialist here. And we are going to be offering more cultural activities like basket making, drums, you know, different wellness support groups are also offered here.
Okay.
And Lavos is a very busy center as well, and they've actually kind of been working with the families in need in Clear Lake as well. So Lavos, there was a gentleman that had been homeless for 7 years on the streets without any support from anybody. And that was due to his mental health issues. He was referred from someone in the community to Lavos. And they were able to get him an assessment for services. He was found to be eligible for the FSP program and is now housed and looking for work, and has definitely stabilized with the mental health issues that he was experiencing. So, and they have plans on doing more groups, kind of outside of the box kind of groups like crocheting and knitting, and continue with the support groups that they have.
Great.
So one story that I do want to share from LaBeaus, kind of shows, no, it's actually kind of both Family Support Center and LaBeaus, but there was a youth in Middletown that tried to die by suicide, and the family was referred over to LaBeaus, Spanish-speaking family, so there's a lot of stigma within that community, you know, reaching out for help or even knowing where help is. The staff at LaBeaus were able to wrap the whole family in services and educate them on mental health issues. And also, you know, gave them all this, because eventually after they were educated and they understood what was happening, they wanted more services. And so now they are actively participating in services, the whole family is. And while that wasn't our parent partner, we do have a new parent partner on board, which is very exciting. So stay tuned for more about those services.
Okay.
Yay,
Okay. Thank you, Carrie.
thank you.
Gina, are you with us? Does not appear to be.
I'm here. I'm
Oh,
here. Hold on.
good.
I was like, I had everything written down, darn it. Let me find it. 1 second. I have like a million tabs open, and so I gotta find the right one. But I can give you guys a brief overview of what the program is. So early intervention services, found it, is a service we provide for individuals who are experiencing either their first episode psychosis or they are clinically high risk for developing psychosis. What we actually have, I feel like we have a lot of successes, but I think one of the biggest one is we were able to graduate a family who's been in a program for like 2 or 3 years. And we were able to get him completely wrapped up and graduated, and now they are living happily on their own independently. But honestly, I think the biggest success is the amount of reduction in hospitalizations we have since enrollment. We have people that have been hospitalized numerous times, and once they're enrolled in our program, there is minimal contact with crisis. And some of these people are very high risk to developing, like, you know, going into crisis and creating that pattern. But once they're enrolled, I mean, they don't, they rarely go back, and that is super, super refreshing. The biggest challenge we have is staffing and employee retention. I'm sure that's across the board. The newest thing we're doing is we have begun to implement Beehive into individual care. Beehive is a data collection tool that basically from beginning to the end of treatment, we're able to track progress, symptoms, and whether they need crisis help. If they're in a crisis, we'll get an alert on our computer, and we will not get that alert relieved until someone goes and addresses the problem behavior, or not problem behavior, but the reason they're in a crisis. And we're also beginning to create a process in which services are streamlined with the help of Access team. Go Access. And we're doing an ongoing symptom management group targeted towards individuals experiencing first episode psychosis. That's it.
Okay, thank you.
Yep.
Next, we have Sabrina. Still here, Sabrina? I know you were here earlier.
I am indeed. My video
Great.
camera was covered. Sorry about that.
It's okay.
So for otherwise, I'd say we've had quite a few successes in the 22-23 year, but I think the biggest one right now is our numbers are going way up for in-person support groups. COVID obviously made us take a hit along with many other folks, but we really did a shift away from office-based support groups to support groups out in the community that are partnered with clothing swaps, diaper pickups, walks in parks, craft days, that kind of stuff. So our numbers are really going up, and we're also seeing a lot of mamas come to more than one, which is a wonderful thing for us to see, is that they're really being enveloped into the program. Biggest challenge in 22-23, like a lot of you, staffing and retention. Very proud to say that since June 23, we've had some really good hires and retention. So fingers crossed on that. And then what's new? We've a couple new things. The first one I want to mention, so that if anyone's got clients that they want to refer to us, is our car seat program. We have given out 45 car seats in the last quarter of 2023 and have a lot more money, so help us spend it. You can go to our website, mother-wise.org, under programs, car seat. It's a quick application or intake. And then folks do need to go through a training module. It's pretty short. And then we have certified car seat technicians who will help them figure out what that looks like in terms of putting it in, making sure it's safe for kiddos. Families can get more than one car seat. We've got boosters, car seats, travel systems. Please, please, please send folks our way. And then the other thing we're working on, still very much in the beginning stages, is expanding our office to include a space dedicated to a community gathering space. We're going to call it the living room. And that it'll be a space free for mamas to come and do classes, crafts, change diapers, breastfeed when they're out in public. Folks do that in our office now, but we're running out of space. So we are going to be expanding. I'll send out much more information when that happens. It's still very much in the early stages. So stay tuned for that.
Great. Thank you, Sabrina. Next, we have, I think it's Chloe from Canuck Senior Support.
Yes, hi. So I'm reporting on the Senior Peer Counseling Program, and you're also aware that Canuck Senior Support has a friendly visiting program. I think that's been mentioned. Our program is to provide counseling, and we maintain a core of senior peer counselors who actually meet weekly for 2 hours to go over their clients and issues and have supervision. We have been fortunate this last year in adding on to our core counselors. This is a small program, and we have a total of 30, I would say 30 overall clients that we served in the last year. All, of course, are older adults and primarily Caucasian. We are increasing outreach as we go along and have successes and reach out. We'd like to have more outreach within the program, and would like to work more with the other services, other peer services available, mental health services. Our clients largely get referred by home care agencies, Meals on Wheels, and adult protective services. We get quite a few from protective services, and of those referred, we might lose 1 out of 3 because they don't follow up. People not identifying with counseling needs and just having too many other things going on, especially medical needs. Large number of it's not on the data here, but so many of them have chronic health conditions. And of course, they need some respite to be able to just talk about that. And our counseling is supportive there. So problems that Our outcomes have been really positive because the counselors, I mean, the clients are like 100% reporting increased well-being, and coping skills is up there too. They are reinforced for using positive coping, and also as far as the reduction of mental health symptoms and reducing loneliness, I would say that we have some amount of success, but it's a tough one, how to get seniors really back into the community and wanting more social interactions. There's just kind of too many issues, family problems, financial problems that they're dealing with on a day-to-day basis. Outreach to senior citizens, senior centers would be advised as a future challenge. It is a challenge in order to get people maybe just before they develop more severe mental health services, or help people at the level that they are getting out before they decline to isolation. So that's just something that we'd like to see work in the future in any way it can. I don't think it's been done yet. So I hope that's a good enough report. We do link all our referrals to our counselors, which we have 10 active counselors at present, and about 22 client visits, on a weekly basis every month. Thank you.
Great. Thank you, Chloe.
Sure.
Next, we have our statewide regional and local projects for suicide prevention. And Kendra, I think you're going to talk about this a little bit. Before I turn it over to you, I was going to mention that particularly that second bullet right there, we do contribute $25,000 toward statewide projects for suicide prevention and stigma reduction. But I'll turn over to you, Kendra.
Okay. So first I want to just discuss a little bit about how this is our, we talk about really it's QPR and Know the Signs, suicide prevention awareness programs that would go into from 7th grade all the way through our adult populations. Our total number served says 134, and really that is higher, but that's the number that we had that we could really talk about our demographics for. That's one of our challenges, is getting youth and adults alike to really fill out demographics for whatever reason that is. But the successes that I think about is that we really have over 300 consumers that we've seen in the 22-23 fiscal year. And a majority of those were our youth in our school settings. And it's nice to see that we can get out there and talk to them about this really sensitive subject. And something that we're working on is just being able to get into more of the schools and provide more of those trainings across the board through all 6 districts. So it's okay for that one.
Okay, next slide.
Mental health first aid. So we're looking at this, and again, when we're looking at our consumers numbers, those are also a little low right there. Some of it has to do with COVID and us being able to get back into the schools. Mental health first aid is teaches you how to kind of identify, respond to signs of mental health challenges, and teaches those to give that initial support until they can connect them with the appropriate help that they need. We have 3 different courses: adult mental health first aid for adults who work with the adult population, youth for adults who work out in the youth population, and then teen mental health first aid, which is that peer-to-peer. And our numbers were down due to we weren't able to really get into the high schools and teach the teen mental health first aid again, but that is something that we are overcoming. We have been into multiple schools again because teen is for our high school students. But we're just, some of the successes I would say is that we are gaining more attendance from our adult population so that they can go out there and people are prepared when they encounter mental health challenges within our community.
Great. Next slide.
Mini grants. All right, me too. All right, so this really is just a program that provides that funding for community-based providers. We had 11, which is really nice. That was up from the 9 we had the year before. We will be opening applications for this coming next year in September, and we're just looking forward to having the funds to be able to help those out in the community provide more. So apply when it opens.
Great. Okay. We're running short on time, so I'm going to speed through these next slides pretty quickly. Our innovation project, we are just winding down our innovation project for our, is titled a full service partnership innovation collaborative, because we're working with other counties and to be able to improve our FSP process, specifically, being able to, really standardize the criteria for becoming an FSP, to graduate from an FSP, and being able to really apply data for what we're doing with the FSP program. That is winding down now. It's more in some of the data collection process and evaluation. We're also looking at another innovation project of improving our workforce education and training programs. Next program or slide. Facility tech needs. This hasn't changed since the last year. We still have the intentions of using the funding to help improve our South Shore Clinic, which needs a major overhaul, and MHSA will contribute to assist with that. It also goes to helping with our electronic health record. We have just obtained a new health record called Smart Care and have been transitioning over to that this past year. And so MHSA has been financially assisting with that as well. Next slide. Workforce education and training. As you've heard a number of folks mentioned, one of our biggest challenges is recruiting and retaining staff. And so workforce education and training is there to assist with that, recognizing that there is we do reside in a mental health, a designated mental health shortage area, meaning that we struggle with finding providers to do the services that we need. What is designed to help not only grow our staff through training, but also to be able to recruit and retain staff with such projects as regional loan, student loan repayment, student scholarships and stipends, and also providing help for our peer support staff to become certified. Next component, or next slide. Okay. Any questions that you might have? I said we're running very low on time, and so any questions? Okay, well, hopefully you got a kind of a good overview of what we're trying to do in Lake County. As you can see, it's very diverse and a lot of different things are taking place. So hopefully you'll take that information to be able to inform yourselves of some ideas that you might have of where we need to go from here.
Great, thank you, Scott. And again, just if you do have questions or things that come to mind, feel free to use the chat. We're gonna take a brief break, and then we're also going to move into breakout rooms. So if questions come up, you're also going to have opportunity to ask them in those smaller spaces. Before we go to break, just because we're going to use that time to get everyone divided up into 3 different spaces, can I do a quick check-in with the peer support centers? Are there any centers that would like to have their own discussion with those in attendance, or is everyone comfortable joining one of the breakout rooms and us being able to include you in that conversation? Any preferences? Or I guess maybe any objections to being just in the breakout rooms we're setting up?
No, we're good going into a breakout room.
Okay. Great. If anything comes up and you want to change, let me know. Otherwise, we will schedule you in there. Let's go ahead and take about 3 minutes, stretch, take a screen break. We'll come back about 11:45 shortly thereafter and get you into breakout rooms. Okay, thank you. Thank you for that, Patty. I'm gonna kind of slowly get us set up here for breakout rooms and let everyone kind of rejoin us. Patty, I am just gonna make a note that as I was creating the breakout rooms, my list disappeared at one point, so there might be 2 or 3 people that somehow didn't get assigned to a room. So when we go to rooms, if you will, please go ahead and just let them into any of the rooms. That's okay. They're fairly even distributed right now. So I think that'll work okay.
Yes, I can definitely do that.
Thank you so much. So if for some reason when I open rooms, you don't have an option, Patty's going to make sure that you get into one of the rooms. Jamie and Paulina and I will be each in one of the rooms with a few different questions to just prompt and hear from you all. So let's look at those briefly, and then I will stop screen sharing and we'll go ahead and get right into breakout rooms and have as much time as we can for those discussions. So I think we'll still be able to have about 25 minutes in each breakout room. And we'll have these questions again for you once we go into those spaces. But what we really are hoping to have some conversation around is what are some of the strengths of Lake County's behavioral health system, whether you heard today or from experiences you've had, what aspects have been most successful in meeting the community needs. And then again, looking at what you've heard from programs, what gaps in programs and services might still exist, and what populations are underserved or most in need. And then the final question that we'll bring into space is where are there opportunities to improve existing MHSA programs to better meet community needs? So again, we'll have these questions as we go into breakout rooms, but we'll have about 25 minutes there. Those who are facilitating will plan to pull everyone back into this joint space at about we'll stay in breakout rooms till about 12:15, and then that way we can have as much conversation there and then just do a little bit of a shorter report out when we come back together. Does that sound okay? Okay, great. Well, then I'm going to go ahead and open breakout rooms, and Patty, thank you for the help if anyone is left in the main room.
Absolutely.
All right. I think we have everybody back. So we'll have to do this fairly short so that we have time to do the next pieces of wrap up. Oh, sorry. Let me share my screen again. Okay. Are you able to see the slides once again? Okay, good deal. But I'm just gonna ask Paulina and Jamie, if you can just give maybe a quick 1 or 2 minute few highlights from the conversation in your room. And maybe Paulina, if I can start with you.
Yep. Yeah, we had a great conversation. I'll say that for strengths, we mainly talked about the availability to have peer support services and how important those are, and also the strength of the behavioral health system of having such dedicated staff really making a difference, as well as collaboration that's happening with community, with the community and with partners. When it comes to gaps, we first talked a little bit about the community may not be aware of all of the different services that are available. And so maybe the need for more communication or a gap in that area. And when it comes to populations that may be underserved, the main groups that popped up were the older adult population, the African American community, and also potentially those who may be suffering from PTSD as well. And then for opportunities to improve programs to better meet the community's needs, I think our conversation really revolved around the need for providing more basic needs services, including transportation. And then we talked about housing, hand washing stations, porta potties, showering units, so also hygiene as well. I'm looking at my notes and I feel like that was it. And then I think also for gaps, I think we also talked about staffing as well. So I think those were the main ones. I wanted to keep it short, but I wanted to thank my group as well. That was a good conversation and good ideas.
Great. Thank you, Paulina. Jamie, do you want to share a few highlights and notes?
Yes, we also had a really good discussion. So some of the strengths that we talked about were just the kind of comprehensiveness and breadth of services in Lake County, especially for being such a small county, and really kind of over the years expanding those services, particularly some of like these outreach programs like the street outreach and also the mobile crisis coming online. And also so many services that are dedicated to kind of specific populations like the peer support services, but then also all of these kind of outreach programs that are meeting the communities where they are. In terms of some of the gaps, one of the things we talked about was people that are kind of like right above the income thresholds that maybe just disqualify them for services and can kind of make them more at risk for being unhoused or for other things. Also just kind of needing to reach out more maybe to like the entire family systems around folks with serious mental illness or that they may have issues as well. Kind of the timeliness of services, and especially around like housing or, you know, getting people, there's that critical moment when people are ready for services and making sure that those services are available and timely in those moments. And then also kind of some of the barriers and opportunity, and then also making sure that the housing are actually like safe environments and kind of safe and good housing, not just kind of any housing. And then around another challenge and kind of similar opportunity is just that there are so many services and people are engaging a lot of different services, but providers might not know what other people are doing. So it's more care coordination, but then also within the different partners of kind of allowing different opportunities for them to be able to communicate more to kind of integrate services better, to kind of work together, to kind of help understand what different people are getting and kind of better make it more efficient and kind of better coordinate those services among folks. And also just making sure that somebody said, making sure that we all know what we all know.
Yeah, thank you. I think there's some definite themes between both of those sharings. And wanting to kind of stick with time, a couple highlights. So I feel like we had some similar things shared, and also just some of the strengths. There was just that an acknowledgement of just being impressed with team and staff and progress that has been made over the last year, and even that was saying, you know, improvement over even the last fall. So just a lot of acknowledgement for that, and being able to have that tie to the community. So I think that that's really great to lift up. Similar to some of the gaps that were identified, thinking about services and populations, but looking at more opportunity for detox and rehab that is Medi-Cal eligible and available in the community, supporting more mental health interventions in schools and combining that with some parenting training as well. And then services in general and more resources for community members who are LGBTQ and families, just to have that more focused resource and service. There was a few different comments around serving individuals who are more homebound or shut in, and especially seniors in the community. And some good conversation around just the need for both resource support as well as navigation support for supporting single mothers and others who might be looking for like family law support or navigation of the legal services and structures that are needed for them to move through the place in life they are. And so there was some good conversation around that as well. And then just other kind of building on youth needs of building in more supports for after school programs, and some conversation around reliability and predictability that can be built into youth schedules and expectations. So I think we had a lot of good conversation, and just kind of to reiterate to everyone, we did grab that conversation in notes as we were sharing. And so that will be part of the community program planning process. If anything else is coming to mind now, welcome you to put that in the chat, and we will definitely check the chat here at the end of the meeting and make sure that we bring any more of those comments and ideas in. And I'm going to talk about a few of the next steps and what to expect. And there are additional opportunities to continue to share those ideas. So if you are someone who needs to reflect on those questions and think a bit more and wants to bring more of that back, please know there are more opportunities to do that, and that is welcomed. So thinking about next steps as we close out here, here's what really the next handful of months will look like as we move forward in pulling together the annual update. And so right now there is available a stakeholder and countywide survey. The next slide that I will show you will actually show you that community survey, and we'll put that in the chat as well. That survey will be open through mid-February, and so I would encourage you all to complete that, but also share that with your contacts and friends and network. The more people who fill that out, the more community voice we have. Following both looking at the notes and the conversation from this meeting and what is received in that community survey, that will all be pulled together and brought back to you all and other community members who may want to join for a second community meeting in March. So that meeting will be focused on sharing what we heard and the themes through that, and being able to have some planning conversations. Then the annual update will be developed, and in May, you can expect to see that open for public comment, so a period for you to review and give feedback, including an actual public hearing where you can come and give that feedback as well. And that will be kind of what to expect for this part of the annual plan and update. So some of those resources, and we're going to share them in the chat now as well. Slides will be available and we'll get these shared as well. So the community survey, this is going to be open through February 12th. So there will be a link in the chat. You can do that right now or share it. The QR code is available. If you are at the peer support centers, you also have paper copies. And if that is preferable, you can fill out the survey and provide feedback in that way as well. And again, this is open to anyone in the county community, so please do share broadly. Beyond that, we would really appreciate feedback you have on this meeting. That helps ensure that future community planning meetings are improving as well, and that they are building in space for you to both hear what you want to hear about mental health and behavioral health services and have the space to share back. And so we would just appreciate any thoughts that you have on the meeting. Again, the link to that survey is in the chat for you, or you can use the QR code on this slide. And then those will stay in the chat here through the end of the meeting, so we won't close that out right away, but just want to say thank you. We know you spent 2.5 hours with us this morning, and it is a busy day, as Scott noted, with also having the pit count. So that time is just really, really valued. Here are some follow-up contacts, and I'm going to stop here and pass off to Scott for any final words.
Again, I just want to thank everyone for being here. We know it's a time commitment. It's extremely important. This MHSA, as you can tell from hearing what people were talking about, really is addressed to helping our community and particularly those that are most in need. And so having your input in that process is paramount. So your participation, you choosing to be here, is recognized as something tremendous, and it's very, very appreciated by our department and I'm sure the community as well. And we hope to keep continuing to working with you. Please, fill out the survey. Come back in March and find the results of what the surveys have said, and that will help us define our planning process all that much more. And please keep with us, and if you can get other people to come along, that'd be great too.
Perfect. Thank you, Scott. And again, the slides will be available, but the Lake County Behavioral Health Services website does have that Mental Health Services Act page. And as Scott mentioned earlier, some new resources being added there to support just further education and information, as well as updates on the annual plan process. So that's always a great resource to check in on. So thank you so much.
By the end of the day, we will be sending out links to these slides and into the recording of this meeting so that you can access it.
Perfect. Thank you, Scott. All right. Well, I hope you all have a great afternoon. Thank you so much for joining.
You too. You too. Thank you.
Thanks so much.